Our capstone project is on the Special Olympics Global Messenger Training. Global Messengers are athletes within the Special Olympics organization that go out into their communities, or in some cases, other states or countries, to encourage others to become a participant, volunteer, or sponsor of Special Olympics. They do this by sharing their own personal stories of success and help to inspire others to further the mission of Special Olympics. So the main idea of our study is to measure the effects of a training program on enhancing the public speaking skills of Special Olympics athletes. Our key areas of focus are public speaking and individuals with intellectual disabilities. So in public speaking, we're focusing on speaking behaviors, organization, eye contact, topic maintenance, and other related things. In our population, which is individuals with intellectual disabilities, we have some things to consider as well. Their specific speech abilities, their social abilities, as well as their language abilities. So we tied these areas of focus together to find different areas of research from other fields, as well as our own, to support our area of interest. We did this by finding 3 different articles that really fit our topic well.
The purpose behind the research study was to determine if Special Olympics athletes could develop, maintain, and generalize specific social skills through a 14-week training program. The skills targeted were eye contact, contributing relevant information, and turn-taking. Social skills are necessary for participation in daily life. They promote independence, social acceptance, social relationships, and increase an individual's quality of life. Without some of these skills, individuals may have more difficulty in school or at risk for rejection, which may translate to under and or unemployment as an adult. The method of the study was a single subject research design with ABCA quasi-experimental repeated measure design. The participants served as their own controls due to the inter- and intra-participant variability with individuals with intellectual disabilities. There were 4 male participants who ranged in ages from 14 to 24. The training sessions were 90 minutes, 2 times per week for 14 weeks. The sessions were broken into 6 phases: baseline, classroom, soccer, a party, and baseline retention phase. The instruction involved direct instruction, modeling, and process training. And after receiving instruction, the participants interacted with typically developing high schoolers to practice their skills. 2 sets of data were collected. The observation skill rating form was filled out by the researchers at baseline, post-classroom, and post-soccer, and was rated on a 3-point scale. And then the parents of the participants also filled out a parent skill rating form, which rated the participants' skill performance among family, friends, strangers, and within the community. While there was variation in the improvement of social skills, there was an overall positive effect of the training on the development of the social skills. Some strengths of this study were the variability in the client's disabilities, the positive transfer of skills, and the pre- and post-surveys. Some weaknesses were the low number of participants, all of whom were male. There was no long-term follow-up on the generalization of the skills, and the lack of controls.
External factors are important to consider when giving a public speech. Research conducted by Fawcett and Miller focused on external attributes by conducting training sessions that targeted outward behaviors appropriate for use when giving a speech. Their study, Training Public Speaking, an Experimental Analysis and Social Validation, was a multiple baseline design across 3 behavioral categories. The researchers directed training sessions with the use of an instructional package, which included 3 behavioral categories. These categories included eye contact, making gestures, and performing specific speaking behaviors. 2 experiments were conducted. The first included the training of an undergraduate college student with no previous training, and the second included 3 low-income paraprofessionals with varying experience to speaking publicly. The progression of the training session was consistent for both groups. The trainee gave the pre-training speech to a full audience. This speech was graded based on the presence of the 3 behavioral categories. After this baseline data was collected, trainees began the training program. The structure of the program included written instruction and behavioral rehearsal. Written instruction was provided to trainees with a manual that explained appropriate behaviors and taught through application examples. A quiz followed each section. Only after completing the quiz with 100% accuracy, the trainee would move on to the rehearsal session of the program. A practice speech was given and feedback focused on the sections of the instructional package completed to that point in the program. For example, trainees first completed the section for eye contact and then gave a practice speech. Feedback provided after the speech focused on eye contact. Then the process was repeated with the focus on the second component of the instructional package, gestures. After completing the written portion and quiz for gestures, the trainee once again completed a rehearsal speech session and was provided feedback on both eye contact and gestures. The process was repeated once more for the final component of the package, speaking behaviors training. All sections were complete. The trainee presented a final post-training speech to a large audience who used the same grading checklist to compare with their pre-training presentation. All percentages of target behaviors increased after the instructional package was introduced. Eye contact increased from 12% to 81%. Mean percent of gestures occurrence improved from 4% to 98%. And mean percent of occurrence for speaking behaviors increased from 13% to 100%. It is concluded that these behaviors only improved after they were explicitly introduced through the program. Further, observers used a 1 through 7 scale system to rate the speaker's overall performance. The components introduced in the instructional package were validated to address and improving public speaking because their introduction lent to improved perceived overall performance deemed by the audience using the 1 to 7 rating scale system. The study does have limitations to consider, including the small sample size. Further, only 2 observers remain consistent in the rating process for pre- and post-presentation audiences. This could suggest lower inter-rater reliability. However, the variety within the sample does help strengthen the ability to generalize this study. Strong improvements in speaking presentations were seen in every trainee, even with differing backgrounds and experience with public speaking. Further, the study followed a clear progression with 3 distinct behavioral factors to eliminate extraneous variables. The study provides encouraging evidence to focus on external factors of eye contact, gestures, and speaking behaviors in both written and rehearsal formats when conducting public speaking training. This conclusion is made as it increased perceived satisfaction from audience members.
So the article that I chose to use was on self-focused attention and public speaking anxiety. So this article was by John Daly and colleagues over at UT Austin, and it was published in the Personality and Individual Differences journal. So the purpose of this study was to examine the connection between highly anxious individuals' public speaking performances and the attention that they put on themselves during their performances. So this is a really cool article because it can be useful for anyone that does any type of public speaking. We know that from past research, we know that a lot of anxiety occurs during public speaking, but there's not a lot of research on why this happens. In this study were 51 students from an undergraduate basic communication course. They were asked to take a survey, and then they were ranked by their scores for high anxiety and low anxiety individuals. So there was 26 high anxiety and 25 low anxiety. The premise for this study was we know that speakers with high anxiety often perform more poorly in front of audiences. This is information that's found from previous research. But the question that Daly and his colleagues wanted to know is, what is it that makes anxious speakers less effective? So the hypothesis was anxious speakers are more self-focused during their presentation, which then results in less effective speeches. So they pay almost excessive attention to themselves and disregarding the environment and the setting around them, and this is what causes less effective presentations. So the method used in this research study was the participants came in and they were provided with an outline on the Titanic disaster. They were given 10 minutes to prepare a speech, and they told that they were going to give it in front of an audience. It's really important to note that all of the participants did say that the amount of preparation time and the topic was not significant in their amount of anxiety that they experienced. Like I said, they gave a speech in front of 3 audience members, and there was a total of 7 audience members that rotated. They were previously instructed on how to do the ratings, and the speakers had no time limit on their speeches. After and during the speech, all of the participants, including the audience members, were asked to perform dependent measures. So the audience member ratings included 2 evaluative questions and also 9 descriptive questions. So the evaluative questions were rate how nervous the speakers appeared and their proficiency in speaking. And then the descriptive questions ask about things such as rating the nervousness of the speaker, their eye contact, their nervous gestures, unnatural pauses, and so on and so forth. Then for the speakers, they were required to give oral accounts of their speeches, and in these oral recounts, they were supposed to include a summary, how they felt, perceptions on their effectiveness, the reactions of the audience, characteristics of the setting, and so on and so forth. The incidental memory task was designed to kind of tap into the speaker's recall of certain features of the setting that they were in. So questions were asked like, what were the color of the walls in the room, and were there windows, and were the shades up or down, and those types of things. Also, there was a questionnaire, and it had 4 components. So they're saying how nervous they felt, how much they enjoyed giving their speech, how competent they felt during their speech, and how they thought they were how much they perceived the audience to like their speech. So the results of this study were actually pretty consistent with the hypothesis that Daly and his colleagues had created in the beginning of the study. So highly anxious speakers performed lower on the incidental memory assessment and on the oral recounts. So they included significantly less non-self-focused recall and more negative statements. So those non-self-focused recall are things like details about the environment and the setting, the color of the shade, or if the windows were open, or if the shades were up or down, and more non-self recall, like those details, are correlated positively with a more effective speech. So the highly anxious speakers had less of that non-self-focused recall. And then they included more negative statements such as, I didn't feel that the audience thought I was effective as a speaker, and so on and so forth. So the evaluative ratings showed that highly anxious speakers were significantly more nervous and significantly worse speakers. The ratings that these audience members gave showed that highly anxious speakers had less eye contact, more frequent pauses, more nervous gestures, and looked at their notes more. So those are all things that previous research has shown that decreases how the audience feels about your speech, or how effective that the audience thinks that your speech is. So a summary of all the results showed that highly anxious speakers paid excessive attention to self, and in turn gave less effective presentations. So they found that paying more attention to yourself actually leads to the audience feeling that your speech is less effective. The strengths of this include numerous methods of assessment and dependent measures, the control of extraneous variables, the incorporation of previous research when creating a hypothesis. The limitations were the difficulty of determining the true cause and effect, the use of difficult memory recall tasks, such as the colors of the walls in the room, and the inability to determine cognitions at the time of the performance. Knowing what causes anxiety in public speaking performances will be really useful when we're creating a training program to teach others how to reduce these behaviors in order to give more effective presentations. The results of this program will help us when we're creating a training program and deciding what methods to use and what behaviors to target. Even though there may not be a direct connection, this information can really help us prepare a training program that fits the specific needs of our participants. We hope to help the Global Messengers gain both competence and confidence in their public speaking skills, and by doing this, further the mission of Special Olympics.